Hello, my name is Faustina M. Msigwa from the Institute of Finance Management in Dar es Salaam, Tanzania. I'm bringing to you a study about COVID-19 pandemic and its implication on education systems in Tanzania. Our COVID-19 disease, for the first time, was reported from Wuhan State, Hubei province in China in December 2019. And since then, the COVID-19 disease spread at a rapid rate in other states in China and in other countries. As today, in September 2020, the updated data shows about 26.8 million COVID cases around the world, which includes 873,000 deaths and about 18.5 thousand recoveries. And this is the data from WHO, Worldometer, and the European Center for the Disease Prevention and Control in September 2020. The COVID-19 pandemic was confirmed to have spread in Africa on 14th of February in 2020, with the first confirmed case in Egypt. The first confirmed case in sub-Saharan Africa was in Nigeria. There has been worries about COVID-19 spread to Africa because of inadequate healthcare systems, lack of equipment, lack of funding, insufficient training of healthcare workers, and insufficient data transmission. Many preventive measures have been implemented in different countries in Africa, including travel restrictions, flight cancellations, event cancellations, school closures, and border closures. However, on 21st of August, the Africa Center for Disease Control and Prevention expressed cautious optimism as the number of new cases took a downturn while warning against complacency. Current data in Africa shows about 1.1 million confirmed cases with about 25,000 deaths and 833,000 recoveries, the data from WHO, Worldometer, and Africa Center for Disease Control and Prevention. Tanzania is an East African country with a total population of about 59.5 million. In Tanzania, on 16th March 2020, the first person was announced to have been affected by COVID-19. On 17th March 2020, the government announced a total-wide closure of all colleges and schools for an unknown period. The last detailed COVID report in Tanzania was in 19th April 2020, which showed about 480 cases and 21 deaths. It has come to a concern of Tanzania government, private education institutions, and individuals that in spite of the occurrence of the pandemic, education of our children should carry on. So this study examines how COVID-19 pandemic has affected the education system in Tanzania. It further suggests measures to be taken to retain a resilient education system for the post-pandemic period. The term education system is so complex and multifaceted. Generally, It is a coordination of teaching operations in an institution. For example, coordination of individuals, which entail administration, teachers, and students. It also entails infrastructure like buildings, facilities, and teaching, and learning materials. It entails functioning like of curriculum, law, policies, regulations, timetable, and uniforms. This study examines implication of COVID-19 pandemic on the aspects, education system aspects of schools governance, mode of delivery, and the curriculum. The study used one-to-one open-ended interviews through phone calls and WhatsApp chats with 12 parents who have children bounded at home due to COVID-19 pandemic. Parents explained about mode of delivery, academic progress of their children. They offered recommendations on how the schools can maintain a fair delivery during occurrence of the pandemic and after reopening. 5 education experts and 6 school teachers explained their perspectives on how COVID-19 has affected learning and how various education stakeholders can intersect with the government to ensure learning continues. Moreover, data were collected from various COVID news and reports from various media. I further read continuous reports on newsletters, on websites and blogs, which write about impact of COVID-19 on education. These data were analyzed using content analysis, and data collected through interviews with parents, teachers, and education specialists were analyzed through thematic analysis of Brown and Clark in 2006. Modes of delivery the modes of delivery that were used during school closures and their effectiveness. Most schools used print materials. These were made available to students through their parents. They used broadcast radio. Schools used mobile phones like e-learning programs. The schools have been sending learning materials, curriculum contents, and instructions. Schools used Twitter and Zoom discussions, push out information, share video, etc. WhatsApp groups for each class and share digital contents, their resources, and also they offer assessment quizzes. Schools also used tutoring. These are phone-based tutoring and SMS supports. Schools also used online learning. Through computers and smartphones, children can access programs like digital learning management systems such as Century Tech, Edmodo, CISO, or ESCAPE. There was the use of platforms that support live video communication, such as Hangouts, Meet, Teams, Skype, WhatsApp, Zoom, and many others. There were TV programs which was among the widely used and most direct way that was used to continue providing education, especially during school closures in Tanzania. TV programs in ITV and DTV were very active during school closures. What was the progress? On 21st May 2020, President Magufuli announced the reopening of all higher learning institutions and high schools that's from 6 candidates only from 1st of June 2020. On 15th of June 2020, the Prime Minister told the Parliament that there were only 66 active COVID-19 cases in the country. In the 16th of June 2020, President Magufuli ordered all the schools, that's nursery, primary, and secondary, to reopen on 29th of June 2020. He also ordered a resume of all social and economic activities that were dormant during the occurrence of COVID-19 disease. What was the implication on education system? During the occurrence of COVID-19 pandemic, there were some serious changes and implication on education system, like the following. There was an effect on the term length and daily timetable. Normally, there have been 2 terms in a year. The first term commences in January to May with 1 or 2 weeks break on March. The second term normally starts on July to November with 1 or 2 break on September. This time around, after reopening from COVID closure, the Minister for Education announced a term program for all schools. She said schools will operate for 5 months and 2 weeks, from end of June to mid-December, with a break of just 1 week in the end of August. Moreover, 2 more hours were added on the normal daily timetable. The minister said this program should be added in order to compensate the hours that were lost and to enable teachers complete the syllabi. Another implication to education system is programs to accelerate learning. In order to identify the learning gaps and to make the lag behind children who during closure did not have an access to technologies and online learning achieve the same as their peer who had an access. After reopening, some schools have introduced remedial programs and learning opportunities to enable children catch up rapidly. Another implication on education system is schools' governance. To cope with COVID, it requires really good and strong leadership at all levels, from the ministry to schools, to ensure a return of an effective school environment. It also needs a firm, coordinated leadership of practical issues from the level of policies to implementation in schools. This has impacted to a teamwork spirit in schools to ensure good preparations to attack COVID. All teachers and staff are working together to ensure there are temperature checks, regular hand wash, and medical standby. Besides, more requirements such as hand sanitizing agents and health insurance were asked from parents. Wearing masks has become part of school uniform. Another implication is on curriculum. Some aspects about coronavirus and COVID-19 are indirectly linked, and hence they form the main part of a hidden curriculum. Hidden curriculum means all things that are learned other than the contents publicized in the normal curriculum. Students are given awareness about coronavirus and COVID-19. They are taught the precaution measures against coronavirus, such as washing hands, rubbing sanitizers, and putting on face masks. In tests and examinations, students are asked questions related to COVID-19 pandemic, the related challenges. All these produce changes in students' values, perceptions, behaviors, and consciousness. Hence, the precautions and other health programs in general form the main part of a hidden curriculum. Another implication on education system in Tanzania is on the formation of coalitions in governance of education and schools between ministries, such as the Ministry of Education, the Ministry of Health, Community Development, Gender, Elderly and Children, the Ministry of Regional Administration and Local Government, business sectors, non-governmental organizations, and voluntary agencies. Coalition governance is fundamental for building strong and systematic responses to education delivery at all levels and to maintain a resilient education systems in the future. The following are recommendations on how to retain a resilient education system for the post-pandemic period. States should try any possible low technology solutions. They should try to maintain motivation to teachers and make them a focus to the response. They should focus on the most vulnerable. States should help parents manage the home learning environment. Schools should envision applying learning strategies which seem to be more effective during school closure. There should be several tracking progresses, and schools and institutions should invest in technology. Thank you for your attention.